Good morning, everyone. Today we're here at Glen Smiles Dental Clinic in Glen Waverley with our very own dentist from Glen Smiles Dental Clinic, Dr. Sachine Gamage. Good morning, Dr. Gamage. Thank you for joining us.
Hi, thank you for having me here.
So, Dr. Gamage, what will we be chatting about today?
So today I was going to talk about missing teeth. So a lot of people have missing teeth, whether it's in their front teeth or back teeth, and I want to talk about different options that they have.
Right, so teeth fall out when we're quite young, but does that happen when you're older too?
Well, usually it doesn't fall out, but because of disease, either gum disease or like a cavity or even a tooth injury. So some people have like sporting injuries. We sometimes unfortunately have to take teeth out, and as a result, then we have to sort of look at options to put them back in.
And what are these options for replacing missing teeth?
Generally, there's three options. Like you can have a denture, a bridge, or an implant. A bridge is like a bridge. There's like two pillars, and the missing tooth is attached. So you have two teeth either side that would attach for the missing tooth. An implant is where we put like a metal screw into the bone and then attach the tooth. And a denture is like a removable appliance where you can sort of clip it in and out. So those are the three different options that people usually have.
Now, do clients and patients get to choose which one works for them, or is that from like the dentist's recommendation?
No, the patient usually chooses. So what happens is we give them all the options and we'll let them know what the positives and negatives for them are. So like usually most of the dental treatment is driven by the patient, but in an informed way. So we'll tell them like, this option may be suitable, but these are the issues of doing it and things like that. And then the patient will give their impact, like sort of what they think, and then we decide together, I guess, what's best for them.
And now, out of these three treatments, what's the most common option, and why do you think it's the most common one?
Well, I think they all range a bit. I think like the bridges are getting out of favor a little bit with implants, because the thing with implants is like the cost difference between a bridge and an implant is not as much. And the benefit with the implant is we don't have to shave teeth. So we have to shave teeth that are good to provide a bridge. So generally implants are quite common these days. So it's like the closest thing that we have to like a normal tooth. So that's something that's getting done more often. But there are even like dentures are still getting done, and like it actually is beneficial for a lot of people. So it really hard to say. It depends on the person and like what their expectations are. But I guess most dentists will provide you with like what would be best for you. So yeah.
Right, now, Dr. Gamage, with these three different treatments, are they permanent, or I know dentures, they can be removed and put back in, right?
Yeah.
So what is like the difference between those three treatments in terms of permanence sitting within the mouth?
Yeah, so like the denture, yeah, it is removable. So we usually recommend to take it off at night, but you can usually wear it during the daytime. So it's not permanent in that sense. It's not like fixed. Whereas the implant and the bridge is fixed. So it's glued in and you don't have to worry about taking it in and out. And especially with the implant, like it's a sort of attached to your bone, and then the top part is attached to the screw that's inside. It's very close to a normal tooth, so you can sort of function normally, eat normally, and you can actually put like good pressure. You can bite hard into that, and even appearance wise is very close to a normal tooth.
So with bridging and implants, once it's inside the mouth, it's out of sight, out of mind. Is that correct?
Yeah. So it's the closest thing to, it's kind of like, I mean, as close as you can get to what you would have had before the tooth was taken out. So.
Well, Dr. Gamage, it's remarkable to hear that there are so many solutions for filling in places of missing teeth. With that, it does bring us to the end of our segment today. So I'd like to thank you for joining us and sharing your expertise.
Yeah, thank you for having me here.
Join us again next week at Glen Smiles Dental Clinic in Glen Waverley to discuss all things to do with your pearly whites.